Hey, I am Tracy. I'm a nursing student at Aspen University, currently taking research and evidence-based research. So today I am recording my signature assignment. I'm really excited because the topic that I'm going to talk to you about is about a clinical problem that I am actually pretty up on. If I say so myself, I would feel like that. And it is the overuse of antibiotics here in the USA. So before we get into that topic, let's first talk about what are antibiotics. So according to WebMD, antibiotics are medicines that help stop infections caused by bacteria. They do this by killing the bacteria or by keeping them from copying themselves or reproducing. That because antibiotics are really important. That's basically what they're saying. Antibiotics are commonly used for UTI, strep throat, bacterial meningitis, bacterial pneumonia, tuberculosis, ear infections, eye infections. Sometimes you don't know what kind of infection you have, or even if you have an infection but you get an antibiotic for. Those are called broad spectrum antibiotics, and we'll talk about that a little more in a moment. But the point is that antibiotics are not bad. So I don't want anybody to listen to this video and assume that I'm saying antibiotics are bad, because they are not bad. We truly do need antibiotics in our society as well as in other societies for the sake of saving lives. So they're not bad, and they're definitely useful and helpful. The problem with antibiotic is when antibiotics are prescribed too much. What it actually does when we're overusing antibiotics, we're actually opening up doors and windows for the use of superbugs, which are basically drug-resistant antibiotics, or antibiotics that have mutated, which I actually wonder have the well, that's another topic. But that happens when patients aren't actually being properly educated about the use of taking their antibiotics. And also, we are also limiting our body to utilize its own immune system to fight off bacteria in the body. So, of course, antibiotics were first introduced to us, or at least hugely widely introduced to us, in the 1940s. It helped save a lot of lives, because a lot of those things that I mentioned, usually when they go untreated for so long, UTIs can turn into kidney infections and possibly lead to kidney failure. Strep throat, if left untreated for too long, can cause later on cardiac issues. And then, of course, we know, like, bacterial pneumonia, if left untreated and the body's own immune system doesn't kick in for anything, you have it can go into respiratory distress, and patients can go into respiratory acidosis and then go into a full-on respiratory arrest. So they're really important. However, when we're not allowing our own immune system to do its job, we kind of run into problems. So according to the CDC in 2015, healthcare providers prescribed 269.4 million over-the-counter antibiotics. So the reason why that is ridiculous is because these are over-the-counter. You don't actually necessarily need to see the doctor for a prolonged period of time for this antibiotic. Go home and take your pills and you'll be fine. And so it's like, okay. And during my research, which I actually didn't even include in this topic, was how 64% of antibiotics that are prescribed are inappropriately prescribed. So that means people are getting these antibiotics and they don't actually need them. So of the 269.4 million people prescribed over-the-counter antibiotics, 64.7 million of those prescriptions were for people under the age of 20 years old. That is a bit ridiculous, given the fact that genuinely younger people without comorbidities tend to have a stronger immune system. That means their body can fight off most infections that most microbes that they are encountered with. And so that means we're not allowing the body to do its job. We're actually suppressing our own system to introduce an outside source into the body to hopefully kill a microbe. And if patients aren't taking it appropriately, then that means that microbe doesn't completely die off, and then it starts to learn, oh, well, this is how that drug works, and I'm going to just change my DNA and genetic makeup to make sure that that doesn't happen. And so our own bodies adjust to changes just like microbes adjust to changes. So it adjusts to the change, and now we have what is called a superbug. And so that happens when people are not being educated about their medications that they're being given, specifically in this case, antibiotics. So bacteria forms a resistance to the antibiotic, which I just talked about. So according to Becker Health, 2 million people contract an infection by bacteria each year. And of those 2 million people that are contracting infections, 2 million people are contracting infections by bacteria that are resistant to antibiotics each year. And of those 2 million people, 23,000 of those people die as a direct result of the infection. So that means these people have these bacteria that are resistant to their drugs because of the over prescribing and the overuse of antibiotics in our society. I do apologize. This is my 5th time recording this because every camera has died on me. Sorry, with that being said, these are direct results. So that's how we're seeing that there are many people who are just getting all of these antibiotics. So now their body is not necessarily able to do what it's supposed to do. The drugs can't do what they've been made to do because it's not like they've been updated anytime recently. And the microbes have already learned the process of the drug. So nothing is working at this point for these people, which is really sad. It really makes me think of a clinical rotation that I did, and I had a patient who was very ill. We knew he had an infection, and we knew exactly where the infection was. It was around his heart. However, the problem is we couldn't tell if the infection was a bacterial infection, a fungal infection, a viral infection. We didn't know what was actually causing the problem, and we didn't know if it was only in the heart or if it was elsewhere, because he was complaining about all sorts of things. Nothing really looked abnormal, but he was clearly not normal. So what was done in that situation, and I say we, but I was a student, so I just came in and I was just doing what I was told. But what was done was that the patient was on broad spectrum antibiotics, as well as broad spectrum antifungals, as well as antivirals. So this patient is taking all of these medications. Who knows what he needs? And the problem is everything's being introduced to his body. So later on, if he's ever introduced to something that his body can't necessarily fight off, these medications aren't actually necessarily going to be useful to him either. So, and as somebody who works in the ER, I do see that happen quite often. Patients are prescribed broad spectrum antibiotics because we are not willing to wait until blood cultures come back to tell us exactly what the problem is. So when we're not waiting to see what the problem is and we're just treating it and not knowing exactly what we're treating, we're actually opening up the doors and the windows to patients getting these superbugs, creating drug-resistant microbes, and people being unable to utilize their own immune systems. So that becomes a huge problem in our society. So the solution to this problem is very easily said. Just stop prescribing antibiotics to an extent. So we don't want to overuse these antibiotics. We need antibiotics to not necessarily be the first line of defense. Now, if grandma who is 80, 90 years old gets a UTI, give that woman some antibiotics. flushing out her system with water is probably not going to be very effective because she's confused. She's not going to remember to drink any water because a UTI affects her completely differently than how it's going to affect a 20-year-old. It's going to have completely different effects. However, though grandma gets the antibiotic right away, maybe that 20-year-old probably shouldn't get an antibiotic right away. You can flush your system out using drinking plenty of water, getting your body to pee as much as possible, gets as much out as possible, depending on when it is detected in the process. I had that situation happen to myself personally. And I went to the doctor. Doctor said you have some white blood cells in your urine, but I'm giving you two options. You can either take an antibiotic and I'll give you a prescription. You can pick it up from the pharmacy, or you can just drink plenty of water and see if you can get rid of it yourself. And I opted to get rid of it myself, and I had no problem. I understand that's not everybody's situation. Not everybody are catching these infections early on. Some people are catching them later on. And when they're caught later on, yes, maybe antibiotics are your better options. But the point is that you're utilizing and being given options before you're just being given antibiotics. So according to Tanya Parrish, a microbiologist, the inappropriate use of antibiotics will lead to microbe resistance to antibiotics, which we just talked about, those super bugs, these bugs that are resistant to everything. She also advises that in some cases, antibiotics should be used as a drug of a last resort. That means there are so many other options to utilize before we get to the necessity of using antibiotics. With that being said, it is important to remember antibiotics are not bad, but what we really need to do is make sure that people are 100% educated on the proper use of taking an antibiotic. So we're not going into people's medicine cabinets and seeing old prescription of antibiotics with pills still in the bottle. So that's when you have an issue. She's the one who started this. Because now these bugs are resistant to just about everything because people aren't necessarily understanding the importance of finishing out their antibiotics. So when we're providing that education as nurses and as physicians, we can avoid those things from developing. Also remembering to give patients more options than just antibiotics. It doesn't make any sense that we have 64% of the antibiotics that are being prescribed are inappropriately being prescribed. That means these people don't actually they don't need this particular antibiotic, or they don't need the antibiotics at all. There's another option, and possibly even a healthier option. Things we want to be able to boost our own immune systems so that we can fight off the more and more things that come into our world. In this case, it's COVID. In another case, it might be something else. A long time ago, it was tuberculosis. But we need to be able to boost our immune system so that we can be able to battle these things on our own, so we don't have to be dependent on antibiotics. A research was done by one of my coworkers, and during her research she told me about it, and she showed me the research how 89% of Americans are resistant to most antibiotics. So that means most people that contract something are probably not going to get anything that's going to help or effective or be very effective. So it's kind of ridiculous. So with that being said, hopefully I didn't sound like I was rambling. I did have my notes with me, but I had those spaced out moments. Like I said, this is my 5th time recording. And I had to resort to my camera on my phone, which I had to use twice because I had a whole other issue. But have a great night, have a great day, have a great break. Thank you. Bye.